Thank you for coming into the office today. It's great to see you. I know you have a neck and a shoulder complaint.
Yes.
Tell me a little bit more about what's going on for you.
So I have some I feel some tension and strain on the lateral side of my neck.
Mm-hmm.
It hurts to kind of turn.
Mm-hmm.
And I have like some pain through that movement.
Yeah, and then you said something was happening with your shoulder.
Yeah, so my shoulder, it's been in pain for the past couple days.
Yeah.
And yeah, it's just been irritating and I haven't been able to practice.
Okay, I understand.
Yeah.
All right, so that's the classic like first encounter start, right?
Yeah.
So the doctor classically will ask the patient what's going on for them. Now you notice I didn't say anything about pain.
Yeah.
And so a lot of times the focus ends up being specifically, the exchange ends up being a conversation about pain.
Yeah.
So you spoke about, neck pain, shoulder pain, right?
Mm-hmm.
So I'm going to reframe this a little bit.
Okay.
So we just kind of threw that out there just to see what would happen, right?
Yeah.
And then the point of the video today is we want to sort of explore this, like kind of the way we do things, right? In the office here. So I'm going to start again. I'm going to say, hey, Venzel, thanks for coming into the office today. It's really great to see you. So notice I used your name this time, right? And I know I saw from your chart, I read your chart, and it said you had some discomfort in your neck and in your shoulder. How can I help you today? Now that's different.
Yes, completely.
Right? I'm putting myself on the line because I'm asking you how I can help you. Now I'm responsible for that, right?
Yeah.
So then you would say, yes, there's something here and here.
Mm-hmm.
Okay, and I understand that you're having some discomfort, and I'm not going to specifically use the word pain because we don't focus on that, although I'm not going to say we don't tend to it, we just don't focus on it, right? Yeah. How is that pain or this discomfort making you feel? And let me, before you answer, I know you're an athlete. So how is this discomfort, and we could say pain, how is that making you feel?
Well, I feel a sense of depression not being able to perform my sport and contribute to my teammates. So I feel like I'm letting them down, even though it's something that doesn't feel logical because I'm injured, but at the same time, I feel like I'm letting my team down, so I feel like I feel a sense of depression and grief.
And that gets overlooked.
Yeah.
If I don't ask you how this is making you feel, right now, so classically, a patient might say, well, it's making me feel pain. Right? They go to the sensation of it, but they don't go to that psychological space, right? So I'm going to present something here, and I've heard this before, that it's a psychological injury. And that's real. Yeah. Especially in athletics. Now, for the reason that you chose is very interesting, and notice that Venzel chose, now we didn't script any of this, right?
No.
So Venzel chose to explain his relationship and value to his team and not him specifically, right? Yeah. So, and I've heard this before, I'm worried about I'm not going to be able to train anymore, that I'm going to, I won't be able to compete, and I might get cut from my team, or I might be just pulled off to the side, right? And whatever the physical injury is going to impede their ability to keep going.
Exactly.
Right?
Yeah.
And athletes don't want that, right? No. It's constant gains, it's constant training, right? Okay. So if we just go back to, please tell me how I can help you. What could I do for you? And I'm going to do it again. I'm going to put my practice on the line. how can I help you today? Before you leave my office, what needs to happen?
I want to be able to get back into some form of practice where I'm not just sitting on IR, injury reserve. I want to be able to do some active therapy. Might not be at full contact, at full speed, but I just want to be able to get back out there so I'm not losing a step, because that's one of the biggest things for myself that I don't want to lose. Is losing a step and losing that competitive edge that I have over the competition.
So practice isn't simply physical practice,
No.
showing up on the field, doing the drills. There's you staying engaged mentally to keep all of that fresh.
Yes.
Right? And notice how Wenzel, and again, this isn't scripted, right?
No.
Because you're an athlete, so you know where this is coming from. And the reason for this video is to share with the folks that this first encounter needs to be reframed, especially with athletes. So notice how he picked something that's based on your mind and not simply just getting out of pain.
Exactly.
So there's this idea that some athletes can actually kind of physically push through a bit of the pain. And we talked about before, the reason for his strain and his pain is probably a faulty motor pattern associated with subthreshold microtrauma, right? So I'm going to ask you this. When do you feel these symptoms onset?
Well, when I feel them, specifically when I feel it is when I'm not engaged on properly, or the drill that I'm doing. I usually feel it in the drill that it feels like I'm going through the motions, and it feels subconscious when I do the drill, but then right after I feel like pain and I feel discomfort, because I'm not like, I feel like one of the reasons why, because I'm not actively thinking about what the purposeful movement. I'm just doing the drill because it's part of the warm-up.
Okay, so it's more associated with drills and not so much with play.
Yes.
Okay, so the big difference there, and you just said it, is during play you're probably heightened, your awareness is more heightened, and during the drills you might be a little bit more turned off, or the drills might be a little more robotic, or you just kind of like, oh, I don't really want to do the ladder right now, I'll go ahead and do the ladder.
Yeah.
So that's when we start to look at, okay, what's wrong, right? So it's not, so if we're going to say, instead of saying what's wrong with you, not calling it a problem, but what if we call it something that you can pay attention to that's a solution. So when we talk about the problem, right, we talk about the problem is the treatment plan. They're one and the same. So what do you feel like you could be doing in real time to solve this?
I would say in some of the drills that I do, I could get more lat activation, so my shoulder probably could be a little more supported, and scaption.
Yeah. Now that's genius, because that's exactly so two things that came to mind immediately when it's the neck and the shoulder complex, especially when it's unilateral, is what is your relationship with stability and what's your relationship to scaption, right?
Yeah.
So I would take Wenzel from here immediately onto the training floor for your assessment, right? Yeah. So let's say it's basketball. I will have a basketball And we're going to go through those active ranges of motion with you in all 3 planes of motion, right?
Yeah.
And even some overhead. Like I would make them all a figure 8.
Got you.
And then I would apply a little overpressure, a little resistance in the second time around through all of those planes of motion, right? You actively, but I'm going to give you a little overpressure. And we're going to look for this little part of a range of motion where it gives way.
Okay.
Okay, and then I'm going to say, okay, again, let's say it's basketball. I'm going to have you pass a basketball, and I want to see if you're trying to pass it from here or if you're out in scaption, like 30 degrees already when you get ready to pass.
Yeah.
Now, I want to make an important point. I haven't even touched you. I did not do the classical orthopedic exams. I didn't palpate you to look for where there's pain. You know why? Because it doesn't have anything to do with the treatment plan. The treatment plan is not elimination of pain primarily. Would you like to feel better?
Yes.
Oh, you bet. And there are many different ways we could go about that, right? Which we're just kind of tricking the brain temporarily, right? But when I assess you holding a basketball, if you play basketball, I can search for those little planes of motion where it gives out, not necessarily where you feel pain.
Yeah.
Then that's a completely different approach.
Because we're addressing the faulty motor pattern.
Exactly. So the goal is to tease it out by using some global movement patterns. So we'll follow up with this. This is just sort of like casual interview. We're going to follow up with this in a different video and show you exactly what we mean, but it's just going to be straight through, right? Yeah. So I hope you got some good new information from that. Hope you enjoyed it. Get ready for this series because it's going to be a really big series. We've got 10 sports, and we're really excited about it, and so stay tuned.